This next session really shifts gears to focus on patient activation and self-care management. This movement is still in its early days, and we have yet to figure out how to make patient self-management an integral component of our healthcare system. We will now hear from one initiative at the MUHC that is ahead of its time in this regard. Dr. Deborah Radcliffe-Branch has directed the My Toolbox program, Mon Atelier en Français, from the start. She is joined by Mario Carlo, a patient and a tea trainer at My Toolbox. Those of you who have read the My Toolbox case study, in your folders you have a set of case studies. You'll have some background on the project. Healthcare industries have long considered clinicians and healthcare administrators to be their main customers and have oriented their efforts to meet healthcare needs as interpreted by those intermediaries. Roche, a major pharmaceutical and diagnostics company, is now shifting towards a patient-centric approach to focus all decisions around what a patient needs. We'll also hear in the second presentation from Ms. Janice Salemba, the Vice President, Customer Strategy and Value from Roche. And she'll be talking to us about the company's efforts to define new solutions, opportunities, and partnerships. And Janice, I would suggest that maybe you just wait and we will. Where are you, Janice? Where's Janice? There you are, great. If you don't mind, I think it'll be best to you can come up to the stage after the presentation that Mario and Deborah have done. So thank you very much.
Good afternoon. Thank you, Patty, and thank you, Susan, for putting together this wonderful conference, and we hope to give you a different perspective this afternoon. I'm going to be speaking first, and Mario Carlo, our program T trainer, T for top, will be speaking shortly afterwards. If anyone was here last night, we heard Shalom talk about chronic conditions and how difficult the healthcare system is challenged to handle chronic conditions. These are acute care facilities, they're meant for acute care, but clearly the people occupying the beds are people with chronic conditions and multiple chronic conditions. So we know chronic health conditions are very, very serious. They cost society, they cost money, they cause people enormous difficulty. But there is a good evidence base that suggests that people with chronic illness who self-manage their disease are more likely to appropriately use healthcare services, have fewer disease-related complications, and experience greater quality of life and overall health. And our data analysis does back this up as well. So chronic diseases, we always think of 80-year-olds, but the prevalence rate of chronic disease is growing faster among Canadians in the age group of 36 to 64 than age 65. And the interaction of these multiple chronic conditions or comorbidities present just enormous challenges to everyone. So chronic conditions really have become the main driver of the healthcare system, and they're a serious threat to its sustainability. And expenditures to treat chronic disease are rising faster than economic growth, which is a very serious issue. Now, the chronic care model, what I want to point out today is that improved outcomes are, if you look at those two white boxes, a result of an informed, activated patient and a prepared, proactive practice team. So what's a prepared practice team look like? At the time of consultation, the healthcare team has the patient's complete information, decision support, staff, equipment, and the time required to deliver evidence-based clinical management and self-management support. Now, what does an informed, activated patient look like? The patient understands the disease process and assumes the role as daily self-manager because they are the one and their families who live with this every day, every year. They're seeing their clinicians a few hours a year. The responsible for management really does lie in their hands. So family and caregivers are important, and they really should be engaged and supportive in the patient self-management. So we spoke a little bit about acute versus chronic, and I just want to point out the changes in the role of the patient and the role of the professional. So with an acute disease, really the role of the professional is to choose and apply the treatment or the therapy. Whereas with chronic conditions, because they occur over a long period of time and there rarely is a cure, the patient really needs to partner with their healthcare professional. And this is really important, and this is what we teach in the My Toolbox program. So My Toolbox is a Stanford licensed program. We didn't write it, we didn't create it. It was created at Stanford University, and it's licensed to many, many institutions all over the world. Patrick McGowan, our Canadian lead, is here in the audience. It's a wonderful program, and it's meant to be in addition to the information that patients get from their health professionals. It's not designed to substitute. So in traditional patient education, what's taught is information and technical skills and the disease, whereas in self-management education, we really focus on problems. And the problems are mainly formulated by the patient. And the relationship of education to the disease is we teach people problem-solving skills relevant to the consequences of living with those chronic disease. And we're really hoping to increase confidence in their capacity to make life-improving changes. And the goal is increased self-efficacy and confidence to improve clinical outcomes. So what is self-management? It's defined as the tasks that people must undertake to live well and have the confidence to deal with medical management, role management, and emotional management of their chronic conditions. When someone's diagnosed with a chronic condition, they have to undertake enormous changes in lifestyle very often, and these are just a quick example of some of the new tasks that they need to undertake. And they do not typically get any formal education in how to accomplish these, and that's where we step in. So as I was mentioning, the patient is managing their illness most of the time. They're seeing their healthcare professionals approximately 12 hours a year. The rest of the time, they're managing it. So why is self-management important? Well, chronic disease places new responsibilities on the individual and their family. Patient education, traditional patient education, doesn't meet all the needs. People manage their disease mostly by themselves. Behavior is important, it's complex and multifaceted, and people need meaningful participation. So what do people learn in self-management programs? A variety of things. They learn actual information and very practical skills. So how to get started with whatever it is they need to get started with. Problem solving, communication skills, and this is a really important one in the healthcare system, where a prepared patient comes to an interview, he's written down the 3 top questions that he wants answered, and he's prepared to only have one of them answered if the time constraints are too severe. So we're really seeing the benefits in the clinical encounter by teaching patients or participants communication skills. We teach evaluating treatment options, how to work well with their health professionals, how to deal with the anger and the fear and frustration that's very common with chronic conditions, and some cognitive techniques such as self-talk, reframing, and relaxation techniques. This is just a photo of a class in session. The classes are attended by anyone with a chronic health condition and their family member if they wish to do so. So it's a very different group of people each time it's run, different ages, different genders. And what we're hoping to do is to really increase self-efficacy with really modeling mastery learning, modeling vicarious learning, and persuasion. So the Stanford program was initiated by Kate Lorig and colleagues at Stanford University. It's considered a best practice and is the most utilized program worldwide. It's a wonderful program because it's designed to be delivered to people with multiple chronic conditions. So it's not just a diabetes program. Anyone with a chronic condition attends because we're really working on the consequences of living with a chronic condition, whether that's arthritis or cancer or diabetes. And the program's been adopted and funded at a national level in a number of countries and throughout Canada, and there are decades of research, including randomized controlled trials. So our program, we use volunteer peer leaders, so they do not get paid. These are volunteers who live with a chronic condition themselves, and that's really important because it makes the experience authentic. So the people that are leading the course know what sort of challenges the people taking the course have. It's a 6-week workshop, 2.5 hours a week, and there are roughly 10 to 12 participants per workshop. And the participants receive a book, a course book that they follow with the course, and we offer it at no cost to participants. This is a workshop overview, the sort of issues that are addressed in each of the 6 sessions. This is a copy of the French book. Now, every time Stanford updates the program, once every 5 years, we're faced with the challenge of translating all the material again, which we've just done, thanks to Mario, greatly. Just to give you another idea of a class in progress, you can note the different age groups. Now, this is a data-driven program at the MUHC, so participants complete a questionnaire at their very first course and then approximately 6 months later, and we look at the changes on outcomes. And I'm just going to mention the outcomes that were statistically significantly improved. So self-management behaviors in about 937 people, coping with symptoms, time doing aerobic exercise, and communication with physicians all increased. Self-efficacy measures, meaning the ability to manage the disease and its symptoms, improved. Health status, so all of the negative affect, the depression, fatigue, health distress, pain severity, illness intrusiveness, all of those measures improved as well. And the lovely part here is the healthcare system utilization went down significantly. Physician visits, emergency room visits, and overnight hospitalizations were cut into almost half. This is an old slide from last year. We're at our 7-year mark now, but it gives you an idea. We've completed about 23 sessions. Now we have had over 1,900 registered participants. We have over 100 trained leaders, 25 master trainers, and 2 T trainers, the only 2 Francophone T trainers in the world. And we've held about 160 workshops, and we've introduced a couple of new programs, one in chronic pain and one with spinal cord injury. We partner with a variety of community partnerships and disease-specific organizations. We're always looking for space to hold the course. We have a conference room where we're situated on Guy, but we like to be as accessible as possible to the patient population. So we deliver courses in the morning, in the afternoon, in the evening. We deliver them in English and in French at multiple venues. This is the Toolbox Leader Team in 2009. Most of them are still with us now teaching. Again, 2010, more recently. So the new initiatives, I just wanted to highlight that the program can be adapted for a specific use, or Stanford has a licensed component for these different programs. So we've implemented Stanford's chronic pain program, and it's been hugely successful. Hugely successful. And we have collaborated with the AQDC in, they really actually paid for our initial training, so they made it happen. We're very good partners. The spinal cord injury program is a very interesting program because it's a 3-pillar program. So it's the My Toolbox program, slightly modified. 6 months of a supervised education program, which we did at Lucy Bruneau, and an educative seminar, which was a half-day event specifically on spinal cord injury. And this is the chronic pain program flyer. So standardized interventions such as My Toolbox require minimal adaptation to specific diseases, so they're potentially more cost-effective and less complicated to translate into practice than those requiring adaptation to each condition. And a continued focus and investment in disease-specific programs really fails to address the reality that most patients have multiple chronic conditions. And now I'd like to introduce Mario de Carlo, who is one of these 2 top trainers in the world a francophone, and he has been with us from the very beginning. In fact, Mario was the first leader that I interviewed when I started this in 2006. So please welcome Mario de Carlo.
So I was her first interview, and when I showed up in the office, she says, okay, I need a police report. I says, what? Why, am I Italian, or what's the problem? She says, no, we do this with everybody. So 7 years ago, my physician said, there's a new program starting, and it's about this self-management concept. And she said, I don't know too much about it, but here's a number. Call this Dr. Deborah Radcliffe-Branch, and she'll tell you all about it. And if you're interested, you can go for it. So that's what I did. And I learned the program and was trained at the same time. I was affected by polio at the age of 1 year old in Italy, small town. The vaccine hadn't come to our area yet, which was invented in 1955. It took several years to get the whole world vaccinated. And I was one of the people that just made it to get the polio virus. And then it kind of subsided everywhere else in Italy. And so we were trained by Dr. Patrick McGowan. If I can ask Patrick to stand up so everybody knows who you are. He co-led the training, which was the first training here in Quebec. And then from here, we started training all kinds of different groups in the province of Quebec. Now Abitibi-Témiscamingue as a program, Outaouais as a program, Chicoutimi, Lanaudière. So we kind of been spreading the word and training other people. Of course, it's a program that needs funding, and every year the MUHC has been kind enough to renew the contract so far. So we don't know the future, right? Touch wood. So this morning, I was up here and we talked about transforming care at the bedside. And I think this is a great segue from there. And I make a parallel, I make a connection between the two programs, where one is really to take care of the patient and empower the patient while the patient is been taken care of here in the institution, but to get the feedback and the input of the patient and work together collaboratively. Now, this program here, for many of those individuals who are left with a chronic condition, who are sent home, well, we provide a training to give them tools, give them techniques to deal with their situation. It's really a program. It's not a self or a support group. And that's one of the things that people confuse. Well, you guys, is it a support group? You get together, you talk about your problems? No. When we get together is really to learn tools so you can self-manage your condition. Last night, Dr. Shalom talked about self-care, and he talked about partnership. And those two concepts for me are complementary, right? And we see this in the toolbox where we have the self-care or self-management, as we like to call it, where we provide tools for people to take care of themselves most of the year. And they have this connection with their physicians who they develop partnerships with. There are several modules that talk about communication and communicating with physicians, dealing with the health systems, and people brainstorm on how to positively find solutions to navigate through the system, better communicate with their physicians, be more prepared before going into the doctor's office, and so on and so forth. So we provide them with a lot of substance so they can manage themselves and have better results with their partners in the medical field. Just to be practical, on the screen you see what we call a vicious circle, vicious cycle, symptoms vicious cycle. And we have, we talk about the disease, which is part of a person's problem with dealing with chronic condition. And we have other things that affect a person's, life. For instance, it could be stress, it could be emotional issues, fatigue, pain, and all of these tension, all of these things affect the individual. It's not just the disease. And that's often when people come into the course, they say, my disease is the cause of all my problems, but it's not true, right? You could be stressed about something else that will affect your disease. You could have emotional issues, and that's psychosomatic. It'll affect your body. You could have tension. You can have pain that's caused because you're being tense, or you're fatigued, so you feel your pain more. All of these things work together. So we show them how all of these things work together, and then we've offered them the tools. And if we can go back to the workshop overview, I think it's slide 18, if I remember correctly. Yeah. So this slide, I can't see it very well, but you notice that we talk about a lot of different issues, including nutrition and communication and problem solving and how to create an action plan and so on and so forth. There's many, many things we cover. And I just want to talk about two of those things that come up most often. And you notice that in each week you have the points represent when in the 6 weeks we talk about it, but you have the action plan that keeps coming up pretty much every week, and you have problem solving. And those are two of the pillars of a person's self-management. So you have, is this the action plan? No, that's a problem solving, right? Problem solving. Okay, the action planning. Okay, so this is the stuff that we cover when we talk about the action planning. How does a person activate themselves and meet objectives? So we start with the first question is, choose something that you want to do. And the you is in capital letters because we don't want the person to pick something that was imposed by somebody else or was strongly recommended by somebody, and they're not necessarily motivated to do it. So we want them to pick something that they're really interested in. They might want to lose weight, which will have an impact on their condition, for instance. And then we ask them to pick something that is, of course, achievable or reasonable for them to do, considering their limitations and where they're at with their health. And we ask them to, I can't see it from here.
To answer the question, what, how much, when, and how often.
Okay, so answer the questions, what, how much, when, and how often, which basically gives parameters to where they need to focus their attention. And then the last point is their self-confidence, right? How self-confident are they that they're going to be achieving their goal? And on a scale of 0 to 10, we ask them to pick a number. If their self-confidence is low, there's probably something wrong in their objective and how they want to do it that doesn't go well. So we ask them to reconsider and ensure that the confidence level is at least a 7. If it's below that, you need to retweak your objective and how you're going to go about doing things. So it gives them the chance to pick something that they want to do, try it for a week, and next week when we get together, we talk about it again, and how did it go? So you give feedback. And if something didn't go the way they planned, then we can talk about it and find solutions, maybe together with others around the room, on what can we change to make sure that we achieve our goals. And then the next week they have a chance to try it again, and then try it again for 6 weeks. So after 6 weeks of dry running, dry running? Yeah, dry running. They finally find a comfort to be able to achieve their goals because they've achieved it several times, so they know what to do. And if they encounter problems, then we have the problem-solving steps. And we show them on how to address the issue and identifying it and finding solutions and trying them. And if they don't work, pick something else from what they brainstormed on how to tackle the problem. And this goes on in the list up to the point where you say, okay, well, now I've tried, I wanted to do this, I wanted to find a solution, I haven't been able to. Maybe it's something that I can't find a solution, I'll put it in the back burner, go back to it later. But don't forget about it. Don't give up. And so we give them all of this list so they can try it and find solutions. And in class, we find a system where we apply some of these things and brainstorm them together. So we usually go with the 3 first elements there. Find something that bothers you, something that troubles you, find a couple of solutions, and let's try them. So they have in-class practice and then in real-life situation. So it works out very well.
The whole goal is to have a very small, reasonably achievable goal and succeed at it. Because many patients with multiple conditions or patients that are in chronic pain, they haven't had that much success. They're very discouraged very often. So to make a reasonably achievable goal and succeed and then build on it progressively over 6 weeks is extremely powerful. It sounds very simple, but it's very powerful. Sorry, Mario.
We usually see a big transformation after the 3rd week because they've tried it and they've succeeded. So they get persuaded through doing it. So that's in a nutshell. We could be going on and on, but this gives you a good picture of where we're at.
Thank you.
Thank you. Let's have another round of applause for our speakers.